from there. So moving ahead, I would like to firstly welcome everyone to this very important panel discussion we have planned today, which is on the topic healthy and green recovery from COVID-19. We are hosting this on the World Nature Conservation Day. Moving ahead, I would like to firstly welcome everyone to this. The YouTube live was going in the background. I'm sorry for that. So I would like to just give the brief about today's session. So if I talk about the intro part, about this whole agenda for the day, it came from the WHO Director General, who addressed the 73rd World Health Assembly on May 18, 2020. And he said that the pandemic is a reminder of the intimate and delicate relationship between people and planet. And he proposed 6 WHO prescriptions and accompanied actionables, which are practical steps for implementing the WHO manifesto for a healthy recovery from COVID-19. So they basically aim to creating a healthier, fairer, and a greener world while investing to maintain and resuscitate the economy hit by the effects of COVID-19. This particular session will be focusing on the 3 of those 6 WHO prescriptions, which are namely prescription number 1, which is on the nature part, prescription number 2, which is on wash, and prescription number 5, which is on the healthy and livable city. So I would like to welcome each and every participants and panelists who have joined us for this very important session. Giving a brief about the panelists we have today. Firstly, Mr. Rajashri Chakrabarti, who is the State Project Officer, UNDP Sikkim. So Rajashri sir has been working in the field of biodiversity conservation and sustainable management of natural resources for the past 15 years. His work has involved designing and implementing projects on conservation of key wildlife species and enhancing community-based natural resource management in the Himalayas, focusing on the Northeast. Currently, he is engaged with UNDP India based out of Sikkim in the GEF MOEFCC UNDP project, Secure Himalayan project, which aims to implement a landscape-based approach to conservation of the Himalayan high Himalayas. So sir would be taking up the prescription number 1, which is on nature, and I heartily welcome Mr. Rajashri for this very important session.
Thank you, and it's a great opportunity.
Thank you, sir. We too. So next up we have Miss Prarthana Bora, who is the India Director for Clean Air Asia. Prarthana leads the implementation of India strategy for Clean Air Asia. She has been working with City Municipal Corporation to assess air quality management status of Indian cities, as well as the preparation implementation of air action plans. As sectoral expert with the Ministry of Housing and Urban Affairs of Government of India for tracking air quality indicators of smart cities, she has been involved in developing the indicators and in training smart cities. Prarthana also leads a Clean Air Asia public and youth engagement program, including the Youth Clean Air Network that trains youth to contribute to better air quality. Apart from this, Prarthana is also a mentor to several innovative startup programs and environmental sustainability strategists with more than 20 years experience, and also an economist by training. She has recently authored a primer on economics of air quality management. We welcome you, Ms. Prarthana. We also have got Mr. V.R. Raman, who is the head of policy in WaterAid India. Raman sir is a public policy expert with close to 3 decades of experience across different Indian states and globally. He holds a multi-sectoral development and policy work profile covering health, nutrition, wash, environment, disaster management, education, and social welfare sector. He has unique involvement with several national flagship missions such as Jal Jeevan Mission, Swachh Bharat Mission, National Health Mission, National Literacy Mission, and Poshan Abhiyan. Currently, he is working as head of policy with WaterAid India, leading a series of research and advocacy initiative on water, sanitation, and hygiene policies, and their linkages to other sectors such as education, nutrition, public health, and other environmental issues. Wash in health and healthcare facilities is a focus area of his work. Welcome, Mr. V.R. Raman. Last but not the least, the moderator for the day, Mr. Manjeet Singh Saluja, who is the National Professional Officer for WHO India. Mr. Saluja has been working in the area of environment and development since last 2 decades. He currently works with WHO Country Office in India as a technical officer for environmental health that includes issue of water and sanitation, climate change, air pollution, chemicals, and its effects on public health. He has been closely coordinating the efforts of WHO Country Office with the Ministry of Health and Family Welfare and the UN partners. He has previously worked in the Indo-German Environment Partnership Program, UNDP, Planning Department, Government of UP, and various international and national NGOs in various states of India. So I welcome Manjeet sir also to the session. And with this, without wasting much time, I hand over the stage to Manjeet sir to take up the proceedings. And yeah, over to you, sir.
Thank you, Silgio. Thank you for these nice words, and thanks to Sphere India for putting up this kind of webinar and also helping me make my job lighter by giving a good context already, starting with what the WHO Director General kind of said at the start of the meeting in May. I think we will keep this as a kind of an informal discussion mode, and I'll kind of try to go through each of the panelists in the order what Silvio said. I'll first invite Mr. Rajarshi, and then Mr. Raman, and then Ms. Pratna to talk about the various prescriptions and highlight some of the key points. But just before, I think what Silgio said in terms of the intimate, this delicate relationship between environment and health, and we all kind of realize that COVID-19 has been the greatest global shock in kind of decades or maybe kind of a century, and hundreds of thousands of lives kind of were lost, and the world economy has faced a huge setback. This has led to a loss of kind of employment, livelihoods, health, and overall kind of the whole process of sustainable development on which we were kind of has somewhere taken a setback. And societies kind of certainly they need to kind of protect themselves, they need to recover as quickly as possible, and that's where this WHO prescription came in. And we certainly cannot kind of go back to the way we did things before. We kind of and the way we were kind of doing things before in some, and I can present just one or two evidence just to kind of set the ball in context in terms of we already aware that these known and avoidable kind of environmental risks to health, they cause at least 12.6 million deaths every year, and they are accounting for about 1/4 of the global burden of disease. This was a 2016 data. And when I'm talking about 12.6 million deaths from the known avoidable environmental risks, and I just checked on the global WHO global dashboard for COVID, the figure was 4.1 million deaths globally from COVID. So you can imagine the proportion which this particular emergency has already kind of taken, and it was much before COVID, but we haven't kind of seen that kind of response, and that's what maybe we'll kind of discuss also in this particular discussion. And so I'll not go kind of much into it in terms of the weight of evidence is kind of clearly showing that there's a need for immediate preventive action on the environmental related impact. It's not that nothing has been done. Country has been, in India, if we see, country has been implementing many solutions that have shown success, and we also saw that kind of both near and long-term returns to the society for these initiatives are very, very high. There's no kind of comparison on the cost. So the purpose of kind of today's discussion is to certainly bring together the experience in the form of highlights, examples, learnings of key actions that have been taken by kind of various stakeholders and relevant sectors to ensure a healthy environment and safety for all the people. And Silvio has already introduced the excellent set of speakers do we have who have already been introduced, and the purpose today is to certainly kind of advocate on these important issues, increase the level of ambition, and multiply the actions kind of with that can obtain results, and we can kind of discuss about it. So I think starting here, the very first prescription to the Green Recovery Manifesto, which we kind of are planning to discuss, and the first one which we are talking about is protecting and preserving the source of human health, that is nature. And my first question is to kind of Mr. Rajarshi to kind of help explain us the connections to kind of health and natural environment. and what could be the rationale for kind of taking these protective? Why is it important? Why do we need to, apart from what I mentioned, kind of why is it important for taking these protective and preservation measures? And also, if you can share some examples from especially the project that you are implementing on conservation of kind of key biodiversity areas. How is biodiversity important, and effective management which can help secure us a long-term kind of ecosystem resilience, and in a way focus on human health. So I think I'll stop there with the first, and give it to Mr. Rajshri for his kind of response. Maybe try to be brief, and then we'll come back to you with some more kind of questions. Over to you, sir.
Yes, sir. Am I audible? Okay. Thank you, Mr. Saluja. And once again, it's a great opportunity and an honor for me to be among such eminent speakers and to be able to talk about such an important topic. And like you've very well defined in the context of this discussion, right now we are still grappling with the pandemic. But governments around the world, they have already, including WHO, of course, they have already set certain priorities and goals which are aiming towards integration of all sectors, environment, human health, as well as animal health. So this is what I'll be primarily focusing around, the approach to integrate all these sectors and how that would lead to a reducing of risk of future epidemics. But just to start with our very increased pace of development and technological advance, we often tend to forget that we are a very small part and a cog in the wheel in the very complex and dynamic ecosystems where we live, and where very small disruption from our part could create imbalance, which would have a ripple effect and ultimately impact our own health. So, like you mentioned, the pandemic has made it abundantly clear that negative interactions between humans and animals have probably had the source of this disease to start with, and it has also created the spread of this disease. So, which could have been largely avoided to a certain extent. And we have also seen examples of the pollution levels in our major cities going down drastically in the initial phases of the lockdown, as well as our water quality of our rivers improving visibly. So that is also an illustration of what coordinated change, very small and quick drastic change can bring in terms of air and water, which are the two most important requirements for human health here. So I think we now more than ever, we are aware that protecting and preserving the environment is not a luxury, but it's the only option that we have to safeguard our own health. And to come to the connections between human health and environment health, we know that the zoonotic disease transmission is caused by, in many cases, it's caused by negative interactions between human and wildlife. So we have activities like illegal trade in wildlife products. We have human-wildlife conflict, which are often starting points for transmission of zoonotic diseases. So governments around the world are trying to adopt an enhanced mechanism for management of zoonotic diseases and trying to control them at source, which includes also trying to reduce the negative human-wildlife interactions or negative interactions between humans and environment to a larger extent. So this is one thing that we are trying to focus on in our project also. And probably I can cite one or two examples in the later phase of the discussion. But I think the focus now should be to integrate all the sectors of human health, animal health, and environment in a manner so that we have an effective safeguard with us, which would enable us to reduce the risk of future epidemics. And it would involve integration from all stakeholders at multiple levels, starting from the ground up, from the frontline workers to the policymakers. And this is what we are trying to do in a pilot basis in India. UNDP India is trying this approach. It's called One Health. I'm sure all of us are aware, this One Health approach, which is integrating the human health, the public health, animal health, and environmental health together. So this One Health approach is one thing also we are trying to focus in certain pilot areas of India along with National Biodiversity Authority. And maybe I could give a concrete example of how it works later. But I think the focus, like you rightly mentioned, is that to integrate the policies and the thinking and the strategies of human health and environment health together, and B, to also reduce our impact, each individual impact and also our collective impact on the habitat, and reduce degradation so that it does not create a negative consequence to our health as well.
Right. Thank you so much. I think you have just set the ball rolling already with kind of talking about One Health approach, and I think integrating the human and the animal health. I think which is very essential. So from nature, I think the second prescription, which again kind of I switch to another important component, which is kind of important for both the human and the animal health, is kind of investing in the essential services from water sanitation to kind of clean energy, and again focusing on the healthcare facilities. And there I would like to bring Mr. V.R. Raman, who kind of heads the policy division at WaterAid. And Raman, we have already heard that very recently there was this JMP report on wash and households, which came out. I think it's just coming hot from the burner in terms of July itself. The headline was that billions of people around the world will be unable to access safely managed kind of household drinking water, sanitation, and hygiene practices in 2030, unless the rate of progress quadruples. What business as usual, we have to go 4 times according to this particular report. And in 2020, it said around 1 in 4 people kind of lacked these safely managed drinking water in their homes, and nearly half of the world population lacked managed sanitation. And COVID especially kind of has highlighted this urgent need to ensure that everyone can access to this, have good hand hygiene, because we have been talking about these COVID appropriate behaviors, and one of them focuses on this. And at the onset of this pandemic, it said that 3 in the 10 people worldwide could not wash their hands with soap and water within their home, so they didn't have those resources. So and here we see in the country where India has kind of embarked on this massive journey through the implementation of Swachh Bharat mission in 2014 itself, and then now moving towards Jal Jeevan mission. So I would like to kind of open with you in terms of as a senior functionary at a national level CSO who's kind of working on wash and health linkages, and that's what we heard from Silgio, that you have already kind of worked in various health missions as well as the Jal Jeevan and Swachh Bharat. And can you help us kind of discuss and share some of the kind of successes and the challenges in this particular area, and what are the kind of the risks and opportunity that COVID has brought, which we can kind of leverage in this particular area? So over to you, Raman, for this. Raman, you are muted. We can't hear you. Yes.
Can you hear me now?
Yeah. Yes.
Sorry. Thanks, Manjit. It was one of the very critical question, and in the order of priority also, like, starting from nature to then, coming into the elements of nature as services is very critical. And one also, the WHO prescription that came in during the General Assembly this year is very timely, because, we are grappling with a lot of gray areas of pandemic, and we need to talk about the greens now. I mean, there is no choice than talking about greens. So this green recovery is something, although the world is going to grapple with the problem for some more time, the thinking groups, think tanks, individuals, organizations, governments, all of us need to also in parallel think about what will happen and how to address the problems that are going to, or waiting for us once the problems are settling. So that's very timely. And the important thing that you told, 2 missions in India, Swachh Bharat mission and Jal Jeevan mission, and I'm looking forward for almost a mission oriented approach, not necessarily a mission for hand hygiene also, which is both linked with Jal Jeevan mission and Swachh Bharat mission. So it can also go as a kind of interlinked component of these, but need to have some very important focused approach for this. And I'll come to that. So that is the third element that we need to look at from a mission oriented approach. And wash and health, when Rajarshi was speaking, the One Health approach, it's quite, since, the first pilot that the PHFI did on the zoonosis and One Health, I was part of the advisory of that research project. at that time itself, whether it is, the Gorakhpur kind of initiative or whatever. So this approach of looking at things from a comprehensive manner is something that very important. From the selective approaches, at least, the pandemic has taught us to look at things from a comprehensive approaches. That is also something that I wanted to underline. The wash and health is a very critical component in this. So we need to, amongst all the other kind of prescriptions, the wash need to get, at least in India we are getting it, but we need to optimize the results of whatever is happening in India, the kind of resource focus that has happened at the central level and the focus that is happening at the state level. But when it comes to the implementation, wherever there are some sharpening is needed, how to get that done is the question that India has to answer in the upcoming days. So one interesting and important thing is that if you look at the Jal Jeevan Mission website, very recently they have put in the focus on water and healthcare facility. As you said, the JMP report has very clearly indicated where the things are. And the JMP report globally has also underlined the importance of the missions that and the contributions that the missions that India has put in here. On the other hand, we need to also, while these are very important globally, we need to also locally look at these things and understand and identify the various technical and other kinds of problems that can happen at the implementation. So districts comes at the focus on this. At the national level, we are going quite, in a missionary fashion. We have looked at all the kind of designs. We have provided guidelines. We have provided money, and the budget allocation is unprecedented for the Jal Jeevan Mission. Now the states have to reciprocate this, and then the districts has to really take the mission approach and look at what all are the key things that actually realize equity inclusion in that to ensure that those people who are actually lacking water and sanitation facilities, hygiene facilities, how to take those facilities to them and ensure operations and maintenance sustainability from that SDG framework. So the marriage of SDG and the mission mode of water and sanitation in India, while it has happened at the national level, we need to really translate that at the district and levels below that, whether it is in the urban areas, whether it is in the rural areas, Gram Panchayat blocks or whatsoever. So that is one. And washing institutions should be really, really focused. Currently, we have a data. That data says, we have close to 68 or whatever percentage of coverage. So that data itself is showing some gap. But the reality can be the actual need. If you look at the male-female requirements within a hospital facility or a school or a Anganwadi center, the number fulfillment is one thing and need fulfillment is another thing. So the needs, we need to look at how much it is actually serving to the purpose of addressing the what priorities is a thing that we need to look at there. And here comes one intervention that WHO, UNICEF is spearheading in India, which is about the hand hygiene for all initiative. So the hand hygiene for initiative, WaterAid and IRC is also supporting WHO, UNICEF in this. So we have prepared now the roadmap for the country. And we are now taking it up, the cabinet secretary and various secretaries of departments, which is having some important roles to play, and then taking it at the state level, district level. So there is a big kind of job that needs to be done about the hand hygiene for all roadmap, wherein hygiene infrastructure is an important area, hygiene behavior of the various staff and human resources, and also that the community level people, how to ensure the behavior, and then how to also look at infection prevention at the hospitals and also the places where children assemble for studying or for the nutrition kind of purposes. So schools and Anganwadis, I mean, and also the waste management part of it, medical waste management, biomedical waste management, and those kinds of things, how to optimize those situations in our healthcare facilities. So there are several issues that we talk about when the hand hygiene and related issues that we need to prioritize. And here I think the government of India has the Panchayat Raj department has taken it up, urban department has taken it up, the cabinet secretary has taken interest in this, and so I'm looking at states now, how things will go forward at the state level and how many states are going to take this up, and then ensure, identify who are missing out, and how to reach to those kinds of populations and institutions, and then to fulfill and then ensure sustainability of those infrastructure, behavior, and all that. So that is something very important. So in this journey, we have Panchayati Raj, rural development, health and family welfare, women and child development, and housing and urban development, drinking water and sanitation, tribal department. All these are coming in as stakeholders, and I'm hopeful that we can. One other important area that I would like to highlight in this green recovery is that the sanitation workers, as to how to kind of bring them into the in the health systems we have human resources for health. Similarly, we need to talk about human resources for wash, and in that we need to place these vulnerable workers and think about the kind of contribution that they are making, and then acknowledging them and ensure their safety. So these are something, and rest of it, linking wash to climate change is also an important agenda. But I'm sure Prarthana will be coming into those areas. So I think I'll close here. Thanks much.
I think with the thank you, Raman. I think with each webinar we get a topic for the new, and always realize that whatever we may have an exclusive discussion, but time is always kind of less, and the issues are always more. So thank you for kind of sharing this important initiative, and which is kind of really giving an example of a cross-cutting implementation in terms of the hand hygiene roadmap, and talking about the roles of kind of different ministries in terms of MOPR, RD, and kind of what you mentioned. I think now I come to the third prescription in terms of where the humans live, and I think that has become the most important place in the world in terms of the cities, and everybody is kind of talking about building kind of healthy and livable cities. And I think in 2030 the Honorable Minister Mr. Hardeep Singh Puri had already kind of said in 2018. I was kind of seeing one of his statements that by 2030 50% of India's population would reside in urban areas. So that's where half of the kind of population is there. So we are aware that kind of cities have become responsible for a dense economic activity, and also for these kind of therefore the greenhouse emissions. And Pratna, your organization Cleaner Asia has been intensively working with many Indian cities on the important issues of kind of air quality. So maybe if you can share in your opinion, Pratna, what makes the cities around the world and also in India specifically, giving some examples with your work in India, unsafe, and why, and what could be the remedial measures that can be taken to ensure we have a safe, clean, and kind of affordable living? I know these are kind of big, heavy words, and the time is limited, but what could be some of these measures which you can just kind of give an indication? Over to you, Pratna.
Thank you, Manjeet, and very interesting, my previous presenters. So so I am unfortunately not as optimistic as the rest of the world when it comes to the post-pandemic recovery. And there is actually a reason for this, because I think all of us were very excited when we saw blue skies during the pandemic. And then as the world opened up, we have now started doing different kind of damage, as we heard in the Northeast and Uttarakhand. So, we are just transferring the damage to more regions as we adapt and take up new lifestyle interests, like, running off to the hills because of the pandemic and because the city is unsafe. Let's go to the hills is something that I hear as part of the conversation from many people. So I think from that perspective, I don't think that the post-pandemic world is going to be, super different from the world that we are living in, because ultimately as humans we are always going to work towards what makes us happy, and that I feel is the area of intervention, is that how do we define happiness and what is our happiness, because that is actually going to build what you just mentioned, safer, livable cities. Let's take a small example. For instance, we live in a city like Delhi. What is our biggest unhappiness? Traveling. And I think if we have to think about it from the perspective of unhappiness, safety, I think that is, suppose we address the area from that perspective, then obviously we will build back better. So I think the pandemic has taught us certain things. Where it is not required, where traveling is not required, we don't travel. we try to adjust to modes of travel, which is, which modes of ways of life which does not involve traveling, which means that we have now gotten used to this virtual mode. So how much can we translate from the physical mode to the virtual mode wherever possible, which would reduce traveling? I think that kind of a lifestyle choice, that kind of indications would actually build up newer strategies which are actually human centric and focused on ourselves, rather than we going out there and saying that we need to save nature. Now, the second point that I want to make is that we did a survey in 295 Asian cities, and 99% of these cities have unhealthy levels of air as far as the WHO standards are concerned. 99%. I'm not talking about, just a Delhi, but I'm talking about Asian cities. And why is it? Because all these cities are developing. They have a very high level of transportation. They have huge energy needs, which translates to cheaper energy. And of course, they are developing at a rapid pace. So they have the usual related problems as far as urbanization is concerned. Now, we breathe almost on an average 20,000 times in a day, and we are breathing that unhealthy air, which we consider unhealthy in terms of the particulate matter levels. So how does how do we actually take this as a major issue and prioritize it as a health issue? I think that is something that we have still not taken seriously, the issue of air. Now, coming to, I've just highlighted two issues because it is a paucity of time. Now let me come to the solution. I think in terms of the solution, this is where I think we need to invest in data. We need to bring out more information. We need to talk to people more in terms of where we stand as far as this unsafety is concerned. And this is probably where we need to invest in getting the right kind of data out there to the people, the right kind of information, because how much information do we have related to health and air quality? I mean, now there are a lot of studies during the pandemic which talk about relationship, but the authenticity of these and whether these are valid or not is a question that we need to ask ourselves. And we need to really figure out where, I mean, from a positive perspective, what is the data that we need to look at in terms of the recovery phases? While the cities were recovering, what is it that worked, which helped to keep the air pollution levels at a conducive to what was happening during the pandemic? So I think innovative data, rather than just information flowing out there, which tells us that so many cities are polluted, innovative data that can actually initiate action. I think that is what we probably need to look at in terms of the post-pandemic recovery. The second is investing in the local, and I think Raman touched on it a bit. How do we look at a local solution? For instance, now we have the National Clean Air Program, which prescribes clean air action plans. While it is good to have clean air action plans which have a particular format and you talk about reducing certain aspects, have we even looked at these plans in a micro way to figure out what is the main source of pollution? It's not necessary that, let's take the case of coal. I think we all talk about coal all the time. We talk about clean energy. But is that something that can be solved locally? And I think what we've not talked about is how do we look at local solutions as far as the city planning and the city clean air planning is concerned. I think that addressing that would, if we can look at a micro level interventions, and when I say local, it might not even be the entire city. For instance, we at Clean Air Asia is now involved in a project where we've just done assessment of the 13 hotspots in Delhi. And in the next phase, we are actually getting into a micro level action for 3 residential hotspots and 6 industrial hotspots. Now, that's a huge exercise because even within a hotspot, you have multiple sources. And how do you identify those sources and how do you actually look at action plans? So I think these are 2 areas that are emerging where we really need to look at local solutions and also, look at how we could find innovative ways to address the problem rather than being prescriptive and saying that, say vehicles are the only source of emissions, or clean energy is what we need transitioning. any one or other one will not work. I think we need holistic, and for that we need a localized approach, both from the geographical perspective and from a community perspective, because when it's local, the community takes ownership. I'll stop there.
Thank you so much, Pratna. I think these 2 points very precise in terms of how data can initiate local action, and we always have been kind of also hearing that yes, there is data. We need to kind of go even local with the data, because there is data at a broad level in terms of the country, but how we can kind of dig into, but how will it move into action becomes a very important point, because otherwise it only becomes a topic for maybe the academicians and the media to discuss, but then it doesn't bring a change at the life at the level of the community. And I think you have already kind of touched upon this whole investing in local solutions, and because when we talk about local solutions, I think that's where the whole community support becomes very important. And I think I'm coming now to Mr. Rashri, because you are already kind of working in this particular area, and this whole natural resource management, and when we kind of talk about this protecting livelihoods, environment, it completely depends upon the source of the support of the people. We have already seen a lot of movements in the forestry sector as well. So in this regard, can you share with us some of the community actions in the area of biodiversity conservation, and how you can relate it to this the healthy and the green recovery aspect? Over to you, sir.
Yeah, absolutely right. I think more and more we are realizing that conservation, be it at a national scale or a regional scale, has to be participatory, and it has to involve the local community. So to be more effective. So what that is something that we are also focusing on in our projects also currently working in the Himalayan states. We know that the local at the core of it, the local community is the custodian of the biodiversity. So to have any long-term management, effective management solution, you have to take their participation from the day one. So be it planning for preservation of a particular habitat of a particular species, or in the context of zoonotic disease or One Health, trying to create a more efficient management system, the participation has to be there. So in terms of One Health, what we are trying to do is that we are also trying to create this community-based participatory zoonosis disease detection systems, where the local community would be given capacity building and training, and simple tools would be given to them how to detect common zoonotic diseases. And then, like Madam Pratna said, the information also has to be translated into intelligence and action. So that is something that we are trying to build from ground up, so that this information actually, once it is generated in terms of a baseline, can reach the policymakers within the desired amount of time, so that effective action can be planned. Just to give an example, I work in Sikkim. So when we were trying to collect a baseline for Sikkim regarding the zoonotic diseases which are prevalent, we came across multiple instances of diseases like scrub typhus and leptospirosis, which are often more prevalent in area where people are living in close association with forests, and who have more interaction with wildlife. So there, the interaction can be both positive and negative. And in terms of negative interaction, like I think I've highlighted before, that the illegal trade in wildlife products, which is the second biggest global illegal trade after narcotics, is a major cause of concern for reducing the risk of future epidemics, as well as the human-wildlife conflict, which is also, I think, one of the biggest conservation challenges facing our country. So in trying to mitigate both these areas, both in terms of illegal hunting, poaching, illegal trade in wildlife, as well as to effectively mitigate human-wildlife conflict scenarios, we have to take into account the community's participation. So be it creating a system of having honorary wildlife wardens from the village level, or a conflict mitigation committee who would be based in the ground up, and they would be able to generate quality data in a time-bound manner, and which could be then again translated and given to the policymakers for providing additional support. So that local context has to be the most prime aspect of our planning, especially in the current pandemic scenario. So this is what we are also trying to do. And also when we talk about green recovery, of course, like we know that some of the livelihood sectors, especially in rural areas of the Himalayas, which have been impacted in the pandemic, are tourism and ecotourism. So we've also seen that humongous impacts that happen to the grassroots ecotourism providers and supporters who are found in the rural areas. So the challenge is also now to promote sustainable livelihood options, and to integrate sustainable strategies and mechanisms to the planning. Like Mr. Raman said, the action has to be also integrated to the government policy and strategies, be it a district planning or the state planning documents or in the different departments. So that is what we are also trying to do, to create effective standard operating procedures, be it in terms of zoonotic disease management or effective management of solid waste, which is another factor which is contributing to degradation of our human health and which again increases the risk of disease transmission. No? So all these factors, if we can have effective standard operating procedures, which are then again apprised to the policymakers and then integrated to the different levels of the government while planning and implementing, I think that would create an effective system from the ground up, having the community or the local people at the core, and that would enable us to have more effective management of the natural resources, including focus on the zoonotic disease management. That's what I think would be relevant for this present context now.
Right. Yeah. Thank you so much. I think that's very useful, and I'm keeping a tab on the time as well. We don't have very much. We only just have 12 minutes left now, and maybe just one last question to Raman and Pratna on this issue, and then maybe if we have 1 or 2 minutes, we can kind of open up for 1 or 2 questions from the participants if there are any. I think Raman, continuing on this community mobilization and kind of aspect, and in the wash sector, we already are seeing a lot of social mobilization in whether it has happened in Swachh Bharat Mission, Jal Jeevan, and then also how this could be kind of useful for the hand hygiene context. And especially, what are your suggestions for the NGOs and the CSOs which are engaged in the wash action in this context? So, Raman, very quickly, if you can highlight in 3 to 4 minutes.
Thanks. So I'll also like some examples came in from Sikkim. I'll also put in some good examples that is that can guide here. One is if you remember the wash fit tool by the World Health Organization. If the Rogi Kalyan Samitis we call in the hospitals or hospital management committees, whatever name in different states, they may be providing different names. So if the wash fit tools can be used, or some adopted within that for our Kaya Kalpa or Swachh Sarvatra or Swachhata guideline, whatever we have. So how to kind of assess the current situation of institutions, and then to make a plan, and then to allocate money, and then to kind of implement that in a very rapid but qualitative fashion. It's a kind of way forward that each of the health facility can go do using 2 kinds of funding support as of now. One is from the existing National Health Mission kind of arrangements, the annual maintenance grant, they call it the RKS fund, they call it whatever there are. And also the special funds that the JJM has now allocated. And the third source that we recently looked at Odisha and Bihar, how the 14th Finance Commission money has been utilized, So from that, we realized that from the 15th Finance Commission, which is rolled out recently. So we have sources available at the local level. So how to pool them, how to tap them, and how to kind of utilize them for the purpose of fulfilling the needs. So we have some examples like Madhya Pradesh, Sihor district, the district level hospital and the community health center and the primary health center in these places. We did these assessments, and that led the Rogi Kalyan Samiti members. They were quite often they don't know what they are supposed to do. So that was the eye opener for them, and they then activized the committee and got the plan done, and the changes whatever is required were kind of initiated. Similar in Hyderabad, Kamareddy district, and similarly in Kerala, you may remember in Wayanad, although it was a post-flood situation, we had a similar assessment and a very quick redressal of Anganwadis and healthcare facilities. In Anganwadi also, the baby-friendly wash facilities is quite important to actually bring in. Then only we can the green recovery, as Prarthana said. Although we are putting things on a very positive note, we know that things are not going to be very easy to do. So unless and until our preparations and our institutional framework for getting the community level action done are not strong enough, we are going to see a lot of challenges for realizing or translating these dreams into reality. So that is something that we need to look at. So at the village level, I would look at village water and sanitation committees, how they can be oriented about the environmental health. I mean, currently we are orienting them on targets. Changing from this, we have to say that what they are supposed to look at and what they are kind of oversees the health of the community, the environment health of it, and the human health of it. So how they can take up those kinds of responsibility, and then providing them sufficient understanding and tools for getting the things done. And this is applicable in schools through school cabinets and school management committees or the parent teacher association, those kinds of things. We have to also count in the coming days marketplaces, workplaces. Those are also very important when we are looking at wash infrastructure there. So I think these are something assessed, and then provide tools for planning, and then help them find funding, and then with accountability how the local institutional structures can look at improve the wash infrastructure, behaviors and access is the question that we need to answer in the coming days. Thank you.
Thank you, Raman. I think excellent examples in terms of the programs, so whether it's the Rogi Kalyan Samiti or the Swachh Sarvatra, which you kind of talked about. And we don't have much time. Otherwise, I would have kind of from community, I would have drilled to the individual level kind of But I think I'll take this opportunity to pose this question to Pratna, where she has already
one important thing that we need to also in this all institutional structure, the Panchayati Raj institutions. How can we bring those Panchayati Raj institutions at the center stage of the action is something that we are missing at point in time. We are seeing them as an implementation agency. We are yet to see them as local government. So that is one thing that we need to see. Thanks.
Yeah, I think you are pointing towards this whole devolution of funds, functions, and functionaries. We are right now only kind of talking about one part of it, which is kind of the implementation, but we have to kind of see the bigger picture. And the Finance Commission, the 15th Finance Commission do talk about giving funds, but what about the functions and functionaries and therefore the capacities associated with it? I think very important. So thank you so much, Raman, for this. Over to Pratna to kind of and here I would like, maybe she has already kind of spoken about investing in local solutions and how communities can become kind of vibrant partners to all these initiatives, but also kind of how can especially the city dwellers, Pratna, very kind of precise question, that how can they become ambassadors, how the city dweller can become ambassadors for this movement for health and environment? What are the kind of maybe 2 or 3 individual actions that each city dweller you would like to give a message to everybody as to what they can do to kind of help contribute to this overall kind of the health and environment and the whole recovery process? Over to you, Pratna.
Thanks, Manjeet. So there are two kinds of roles that an individual can actually take up. One is being a community leader in terms of propagating or developing a solution that is not just for him or her. And for that, I'd like to cite a small example in terms of how, say, a school can become an institution for promoting a good behavior. So we have a project which actually looks at the concept of play in terms of clean air. So basically, we all like to send our kids out to play, but how many of us actually look at the air quality when the child goes out to play? And it's a very important concept. So what we are doing is we are trying to engage with the school system in terms of assessing the cleanliness of the air, or how clean is your air in the playground when your child is going out to play. So what happens in a place like Delhi is that, if you see the toddlers, they are actually sent out in the morning at 8 o'clock to do their yoga, which is actually not the correct time to do their PT exercises, right? The simple solution would be to stagger it or to wear watch. So when we were doing a survey of the playgrounds, we found many of these playgrounds were actually near the gate. So the moment you enter, you have the playground. So it's a simple solution was that how do you minimize the traffic around that area? So I think that is an approach where we look at, engaging communities so the community can take ownership, because, who doesn't want a clean space? Which parent doesn't want a clean space for the child? And which school wouldn't like to promote the fact that, oh, we have clean air in our schools because we're monitoring it and we are staggering time. So that's one kind of a, way of actually engagement, where we let the person, the person who is involved get actually, become the beneficiary of the solution. The other is, of course, our own lifestyle choices. I think the pandemic has taught us that we can actually survive with very little. I mean, so many of the things that we have accumulated were practically useless. I mean, I think the only thing we were concerned about is good health, right? And I think the only thing we were concerned about is whether we need a good exercise and we need some basic food. But the rest of the things were actually are useless. And many of us, I think we have cupboard full of, say, clothes and shoes and things like that, which brings us to the concept of consumption, which is actually, if you look at it, much of the reason for what is happening to the world today because of our consumption habits, right? So I think one of the things is to look at, this, all these new concepts are today being talked about in terms of, you're talking about the circular economy, which reduces waste, and you're talking about, ecological restoration. But I think over the years, if you look at the environmental debate or the environmental conservation, we've been always talked about sustainable lifestyles, which means like using what you need, and the concepts like ecological footprint, which actually measures what is actually necessary and which doesn't do harm to the world. So I think we need to bring some of those concepts back and gauge our need from the perspective of not doing harm to nature. And I think that could be, I mean, what choice you take is your decision. But if you really realize that, okay, I can reduce in this aspect of my life because I really don't need it, I think it would make a lot of difference as far as, the whole community is also concerned.
Thank you so much, Pratna. I think very important for city dwellers, and the example which you gave, how we kind of do not realize, and since kind of time immemorial, we have seen that the morning, the PT periods are in the morning, and the playgrounds kind of how close are they to the traffic, and where the children are kind of getting exposed. So thank you so much for kind of bringing these very interesting examples. I see the time. I think we have almost finished the time allotted for us. It's already 5:58. Just reflecting on what each of you said in terms of, I remember Mr. Rajashi to kind of talking about, and he started with that it is the only option for survival. So we kind of know very clear, strong words that we don't have any other kind of path. And I think that's where Pratna ending it with kind of talking about sustainable consumption becomes an important part. And we saw kind of Raman giving us examples of how integration can happen, how kind of various departments and ministries can come together. It's not that it has not been done. There are examples of it. There are programs and policies for it. We have been embarking on this journey of kind of decentralization since the 90s, but we need to kind of really implement it. And that's where I think we need to maybe press the accelerator and kind of be more effective on this. So thank you so much for your kind of responses on this. And also I think I'm sure Sphere would have noted multiple webinar sessions which have kind of ideas which have come from each of the participants, whether it's consumption, sustainable consumption, or kind of talking about hand hygiene, and also kind of various integration, what Raman said, and in terms of what in terms of the natural resource management and the whole kind of community action, what Rajashi kind of spoke about. So I think I'll stop here. I'm kind of dot on time. Last 1 minute. Back to you, Silgio. And if there are any kind of questions, I do not see anything in the chat, but just in case if there are anything, we'll be happy to take for a minute or so, and you can please then wind up. Over to you, Silgio.
Hi, so thank you so much. It was such a heartwarming experience to listen to all of you, like such good experts here. Without wasting much time, we can have, as Manjit sir said, we can have 1 minute here to take up the questions if we have got any. Quickly, if anybody from our participants wants to raise any question, they can raise their hands up, or like share it in the chat box and we can take it up. We have got speakers with us. Else I'll even give the unmuting rights for all. So yeah, Jan, if anyone wants to share anything. So maybe we can take it up later. So as Raman sir already shared, like he has got other commitments, and I know all of you are busy with your life. So without wasting much time, we can conclude today's session. I would just like to thank each and every one of you. Firstly, we are so glad that we could all gather here on this amazing session, and also that too on the World Nature Conservation Day. We were blessed enough to have such outstanding resource persons today who are leading and setting goals in their own sectors, and indeed all three has justified their roles. All the sharings, your expertise, knowledge, whatever you shared, it was really wonderful, and it has been a great experience for us as a listener to be in this session. Thank you so much for joining us. I would also like to thank Mr. Manjeet Saluja for your wonderful and effective moderation, and also for all your guidance and support for hosting this webinar, sir. Thank you so much. Finally, I would like to thank all the participants who joined us over here and also through YouTube. Keep up your spirit, and let's all work together towards a healthy and greener world to recover from the COVID. So yeah, with this, we may conclude the session. Thank you so much.
Thank you. And thank you once again, Pratna, Raman, and Arshi for joining us. Bye-bye.
Bye.